If you wake up every single morning with a bloated stomach, that heavy, tight feeling that does not go away even after breakfast meal,
If you hit 2 in the afternoon completely drained even though you slept, and if you carry that dull, persistent inflammation in your joints,
your skin, your body, that no blood test seems to explain, what I am going to show you today may be the most useful video you watch this year.
because what I have found, after working with hundreds of patients who described exactly those symptoms, is that the problem is almost never what people think it is.
It is not gluten intolerance, it is not hormones, it is not lack of exercise. It is 8 specific daily habits, 8 things most of us do.
Or fail to do, between waking up and going to sleep stalling, that keep the gut inflamed, the immune system stuck in high alert,
And the mitochondria running at roughly 20% capacity. And the most important part, all 8 are reversible.
no prescription, no expensive supplement, no restrictive elimination diet, just 8 behavioral changes that my patients have implemented.
And that eliminated their bloating, inflammation, and chronic fatigue in an average of 21 days.
There is one thing inside this protocol, inside habit number 6 picks, that goes against almost everything your doctor has probably told you about meal timing.
And it is, in my clinical experience, the single fastest turnaround that exists for people dealing with chronic fatigue. Stay with me until we get there. Here is exactly what I am going to walk you through in this video. Promise number 1, the first 2 habits of the protocol.
What you do in the first 20 minutes after waking up SAOD, and why these are the only 2 habits that, if you do not fix them first,
And make the other 6 significantly less effective. Promise number 2, the specific hydration mistake that 92% of my patients make without knowing it.
And that is alone responsible for persistent bloating and brain fog throughout the day. Promise number 3, habit number 5,
Which I call the anti-inflammatory window, backed by 18 studies on circadian rhythm and immune response with practical instructions you can apply starting tomorrow morning. Promise number 4, habit number 6, what I call the dinner inversion tout, the habit that contradicts standard nutritional advice.
and that produced measurable fatigue reduction in 4 to 7 days in my patients. Promise number 5, habit number 8,
And the only nighttime habit in this protocol, and why 3 minutes before sleep may be more powerful than any magnesium supplement for regulating systemic inflammation. I'm a physician with a specialization in functional medicine and clinical gastroenterology. The focus of my practice is the intersection between the gut,
the immune system, and energy metabolism crate, what my patients describe as feeling chronically broken on the inside while their labs come back normal.
I see patients in clinic and follow them over months. What that gives me is something a single study cannot give: repeating patterns across real people, across different age groups and different histories. The 8 habits I am going to walk you through today emerged from those patterns.
Cross-referenced with the most current literature in chronobiology, microbiome science, and clinical immunology.
Before I walk you through the 8 habits, I need to explain why the symptoms you are experiencing, bloating, inflammation, and fatigue, are so common, tend to persist even when people have already tried everything. The answer is a concept called accumulated inflammatory load.
Your immune system has a buffer capacity. Think of it like a bathtub with a drain. As long as the volume of inflammatory triggers coming in stays below the system's drainage capacity, you feel nothing. But when you consistently exceed that capacity pipes, with fragmented sleep patterns,
Cortisol spikes in the morning, dysregulated eating windows, artificial light exposure at night, the bathtub starts to overflow.
and when it overflows, the symptoms that emerge do not look like acute inflammation. They look like diffuse bloating.
Like fatigue that does not resolve with rest, like low-grade inflammation that standard inflammatory markers P, conventional CRP, a standard blood count P,
Sometimes do not capture because they are not sensitive enough. That is why your labs come back normal and you still feel terrible.
The problem is not the absence of disease. The problem is a chronically overloaded system operating below the threshold of conventional detection. The 8 habits I am going to show you attack accumulated inflammatory load from 8 different entry points. When you implement them together,
Effect is not linear. It is compounding. That is why the results appear quickly, in days, not months.
habit number 1, natural light in the first 20 minutes after waking up. This is not about being healthy in a broad sense. This is about a specific mechanism.
Your circadian clock is regulated primarily by a cluster of neurons in the hypothalamus called the suprachiasmatic nucleus.
It synchronizes virtually every biological process in your body, including your morning cortisol curve, serotonin production,
using one primary reference signal: the light that enters your eyes immediately after you wake up.
When you wake up and go straight to your phone screen, or stay in a room with low-intensity artificial light, the signal reaching the suprachiasmatic nucleus is ambiguous.
The clock does not synchronize correctly. And a desynchronized circadian clock produces, in a reproducible and well-documented way,
one of the primary pro-inflammatory cytokines, throughout the entire day, which means checking your phone before seeing natural light is not just a bad productivity habit.
It is a direct trigger of systemic inflammation. The clinical prescription I give my patients is simple.
In the first 20 minutes after waking up, step outside or sit in front of a window with direct sunlight for at least 2 to 5 minutes.
If you live somewhere without much morning sun, a 10,000 lux light therapy lamp is a proven substitute.
Habit number 2, 300 to 500 milliliters of water before any food or coffee. I know this sounds basic, but the mechanism matters.
Hyperinflations, and most people do not know what it is. During sleep, you lose on average 400 to 600 milliliters of water just
You wake up in a state of mild to moderate dehydration, almost without exception. And the gut, specifically the cells of the intestinal epithelium
has one of the highest hydration requirements in the body to maintain the integrity of the mucosal barrier. When you wake up dehydrated and go straight to coffee,
2 problems occur. Coffee is a mild diuretic, which deepens the dehydration, and the mucosal barrier of the gut, which should be dense and impermeable, becomes compromised by heat, increasing what the literature calls intestinal permeability, commonly known as leaky gut. And a permeable gut is an inflamed gut.
the correct order is water first, coffee second, 300 to 500 milliliters, room temperature or slightly warm.
These 2 habits, light and water before everything else, are the foundation. If you do not implement them, the 6 that follow have reduced effectiveness. Because the circadian clock will remain desynchronized and the gut barrier will remain under stress from the very first hour of the day. Habit number 3, no liquids during meals. And the reason is going to surprise you. This is the hydration mistake I mentioned in the promises.
92% of my patients with post-meal bloating complaints drink water, juice, or any liquid while eating.
And almost all of them believe this is neutral or even beneficial hab. It helps the food go down. What physiology says is different.
The stomach secretes hydrochloric acid to digest proteins and activate digestive enzymes. The ideal pH of
when you dilute that environment with 200, 300 milliliters of liquid during a meal, the pH rises. Enzymes like pepsin.
Protein arrives in the small intestine only partially digested. Partially digested protein in the small intestine is food for bacteria that should not be feeding there.
This produces gas, fermentation, and the bloating you feel 1 to 2 hours after eating. The prescription.
If you need some liquid during the meal for texture or medication, no more than 100 milliliters of warm water, never cold foul.
Cold water causes pyloric spasm and slows gastric emptying. Habit number 4, 30 chews per bite. I know that sounds absurd. Stay with me.
Digestion begins in the mouth. The enzyme salivary amylase breaks complex carbohydrates down into maltose.
The less you chew, the less amylase you release, the less you pre-digest carbohydrates, and the more work is left for the intestine.
Beyond that, prolonged chewing activates the vagus nerve, the nerve connecting the brain to the gut, which, when adequately stimulated before swallowing,
signals the entire digestive system to enter rest and digest mode. When that signal does not arrive, the digestive system works in emergency mode, producing irregular motility. Sometimes too fast, sometimes too slow and bloating. 30 chews per bite sounds like an arbitrary number. It is not.
It is the number that, in motility studies, produces the lowest index of residual post-meal fermentation. If you cannot count that,
the practical criterion is chew until the food is fully homogeneous in your mouth, until there is no texture left. We are at the midpoint of the protocol, and these next 2 habits are the ones my patients consistently report as having the highest impact. One because it is counterintuitive, the other because it is the easiest to implement. Habit number 5, the anti-inflammatory window.
Light movement at a specific time of day. I am not talking about exercise. I am talking about light movement, a 10 to 15-minute walk.
Gentle mobility, any low-intensity activity taught within a specific window, 30 to 90 minutes after your main meal of the day.
The mechanism is this. When you move gently after eating, the contracting muscles produce a protein called
Interleukin 10 acts as an active regulator of the intestinal inflammatory response. It does not just reduce existing inflammation.
8 studies in chronobiology published between 2018 and 2024 converge on the same result. Low-intensity movement in this specific window
Specifically, high-sensitivity CRP and TNF-alpha in a statistic 4 to 6 weeks of consistent application. This is not about burning calories. It is about using muscle as an anti-inflammatory endocrine organ at the moment when the gut is most receptive to that signal.
The practical prescription: a 10 to 15-minute walk after lunch. It does not need to be fast. It does not need to be outdoors. It can be inside your home.
Now we are dive at habit number 6. I promised you, this one contradicts standard nutritional advice. And it does. Habit number 6, the dinner inversion heel. Your evening meal should be the smallest and simplest meal of the day, and it should end at least 3 hours before you go to sleep. The standard advice most people receive is about calories and portion control. Eat less at night because you will use less energy.
The bigger problem is the intestinal cleaning cycle. The small intestine has a cleaning system called the migrating motor complex.
This complex functions like a sweeper that moves undigested material, bacteria, and metabolic debris, meaning when there is no active food being digested. One complete cycle of the migrating motor complex takes 90 to 120 minutes.
For you to have 2 complete cycles during the night, which the literature indicates as the minimum for adequate intestinal cleaning spend,
your stomach needs to be empty at least 3 hours before you fall asleep.
When you eat dinner late, at 10-11 at night, and go to sleep shortly after, the migrating motor complex completes no cycles during sleep.
Undigested material ferments. You wake up bloated with a coated tongue with that feeling that digestion never finished. Because it did not finish.
The dinner inversion is this. Shift your largest meal to lunch. Make dinner light height, easy to digest protein,
and finish eating 3 hours before you lie down. My patients who implement this habit alone report habit number 7, a 20-minute decompression window optum, and why your afternoon cortisol is destroying your gut. Cortisol is frequently discussed in the context of stress and weight gain. What is less discussed is the direct effect of chronic cortisol on intestinal permeability.
Cortisol, when chronically elevated, suppresses the production of tight junction proteins, the proteins that hold intestinal epithelial cells together. When these proteins are suppressed, the spaces between intestinal cells widen. The gut becomes permeable.
Bacterial endotoxins begin crossing the barrier and entering the bloodstream. This activates the immune system. Systemic low-grade inflammation, fatigue, brain fog, diffuse pain, all of it originating from a gut inflamed by chronic cortisol. The 20-minute decompression window works like this. Between 2 and 4 in the afternoon, the period when circadian cortisol has a secondary peak in people under chronic stress load you interrupt all high-demand cognitive activity for 20 minutes. This is not meditation. It does not have to be. It can be a short walk without headphones.
It can be sitting with a cup of coffee away from any screen. It can be anything that reduces threat processing in the prefrontal cortex. 20 minutes of real cognitive pause in that window reduces the secondary cortisol peak by 35 to 40%, according to heart rate variability studies published in 2022.
35 to 40% less cortisol in that window is the difference between an intestinal epithelium that regenerates overnight and one that spends the night under stress. Habit number 8, 4-7-8 diaphragmatic breathing for 3 minutes before sleep. This is the only nighttime habit in the protocol. And it is the one that generates the most initial skepticism until my patients see the result. The 4-7-8 technique is simple.
Inhale through your nose for 4 seconds, hold for 7 seconds, exhale completely through your mouth for 8 seconds. Repeat for 3 minutes.
Approximately 4 complete cycles. What this does physiologically is not mystical in any way.
Prolonged exhalation, specifically an exhalation longer than the inhalation, directly activates the parasympathetic nervous system.
This is because heart rate is controlled, in part, by the phrenic nerve and the vagus nerve, which respond to intrapulmonary pressure patterns. A long exhalation increases pressure on the vagus nerve, which increases parasympathetic tone. First, it reduces nighttime cortisol levels, which, as I explained in Habit 7, is one of the primary disruptors of the gut barrier.
Second, it increases endogenous melatonin production earlier in the curve, which improves sleep architecture. especially deep sleep,
which is when the majority of immune repair occurs. Third, it increases the tone of the intestinal vagus nerve, which in 3 minutes, 4, 7, 8, before bed. It is literally the only intervention I know of that acts simultaneously on cortisol, melatonin, and intestinal motility. No magnesium supplement, however good, can access those 3 vectors at the same time the way the autonomic nervous system can when it is properly activated. Let me walk you through all 8 habits in chronological sequence so you can see how they fit together across the day. At meals, habit 3 part, no liquid during meals, preserves gastric pH and prevents fermentation from undigested protein. Upon waking, habit 1 part, natural light or light therapy lamp in the first 20 minutes, synchronizes the circadian clock and prevents the interleukin-6 inflammatory spike.
Habit 2 canned, 300 to 500 milliliters of water before coffee. Restores the intestinal mucosal barrier.
Activates salivary amylase and the vagal signal before swallowing.
In the afternoon and evening, habit 5 is 10 to 15-minute walk within 90 minutes of your main meal. Habit 6, light dinner, finished 3 hours before sleep. Allows the migrating motor complex to complete 2 full intestinal cleaning cycles. Habit 7 20 minutes of cognitive pause between 2 and 4 in the afternoon. Reduces the secondary cortisol peak and protects the intestinal epithelium. Before sleep, habit 8 pad, 4, 7, 8 for 3 minutes. Activates the parasympathetic nerve, reduces nighttime cortisol. 8 habits, distributed across the day, each one attacking a different entry point of accumulated inflammatory load.
And the outcome my patients report Mulcher, at an average of 2001 days printfit, is exactly what this video's title promises.
Less bloating, less systemic inflammation, and a quality of sustained energy throughout the day that many of them had not felt in years. Before I close, I need to say something that most health videos do not say. These 8 habits work hard, and they work well for the majority of people with functional bloating, low-grade inflammation. But there are clinical conditions that produce identical symptoms, and that require specific medical investigation.
Small intestinal bacterial overgrowth, or SIBO, requires a hydrogen breath test and a specific treatment protocol.
Thyroid disease, especially subclinical hypothyroidism, produces fatigue and inflammation that no lifestyle habit will resolve without hormonal correction. If you have already tried lifestyle changes, investigate. Ask your doctor for a high sensitivity CRP, ferritin.
Those are the 4 markers that, in my experience, reveal the most frequent structural causes sitting underneath the symptoms I described.
I say this because my job is not to make you believe that habit fixes everything. My job is to give you the most powerful tool available, TAR, which in most cases is behavior power, and to be honest about where that tool has limits. If you have made it this far, you have the complete protocol, 8 habits, the mechanism behind each one, and the clinical sequence in which to implement them. But I want to leave you with one thought about implementation, because that is where most people fail. Do not try to implement all 8 at the same time. The attention cost of trying to change 8 behaviors simultaneously produces what you run out of cognitive bandwidth and abandon everything around day 12 to 14. The sequence I recommend is this. Implement habits 1 and 2 in week 1. They are the easiest and they are the foundation. In week 2, add habits 3 and 8, the liquid restriction during meals and the nighttime breathing. In week 3, add habits 5 and 6. In week 4, habits 4 and 7, 28 days to the full protocol. And by week 5, you will notice that most of them no longer require conscious attention pair. Penhantum, vacillation. They have podike. They have become automatic. If you want a visual guide with the complete protocol, an implementation timeline, a daily checklist, and references to. And if this video was useful to you, share it with someone you know who constantly complains about bloating or fatigue that never goes away. Because the answer is probably here at Want, and nobody has probably ever explained to them why the problem is happening in the first place. I will Atman Kupanam. I will to you with the Natanan. I will see you in the next video.